Good afternoon and welcome to today's program titled How to Best Leverage Multi-Location Digital Marketing Strategies in Addiction Treatment. I'm Tom Valentino, Senior Editor of Behavioral Healthcare Executive Magazine. Today's program is sponsored by Dreamscape Marketing. Thank you to our sponsor and to our audience for giving us your time and attention today. Before we get started, we have a few housekeeping details. You can use the Q&A area below the slides to submit a question about the presentation or a technical question at any time. You do not have to wait until the end of the program to submit your question. To download the slide deck, click the Resources tab to the right of the presentation window. And you can also join our webinar conversation on Twitter by using our hashtag BHELiveWebinar. At this time, it's my pleasure to introduce our speaker, Dan Kemp, President and CEO of Dreamscape Marketing. Dan has been with the company since its founding in 2005. While at Dreamscape, Dan originated custom strategies for the effective implementation of internet and search marketing, as well as social and mobile advertising campaigns. He maintains a focus on extremely efficient and proprietary search engine optimization techniques focused on return on investment, driven methodologies, and metrics. Thank you to Dan for taking the time to speak with us today, and with that, the audience is yours.
Thank you, Tom. And I would imagine you all know this already, but he didn't want to say all of those nice things. He had to say all of those nice things. But hopefully, some of that credibility will lend itself as expertise today, and I can teach you all something useful. So, again, today's presentation is about how to best leverage multi-location digital marketing strategies specifically for addiction treatment. This is an area where I've had a lot of experience, and I will reference some specific instances along the way. So, how does everything begin these days? How does marketing impact the addiction treatment space in general? 83% of the time, it begins on Google. So, we will today as well. How is marketing multi-location treatment programs online any better? Really, we're trying to compare and contrast from single location marketing to the advantages of multi-location. Who am I to talk about that? Again, I'm Dan Kemp. I own Dreamscape Marketing, and we have done large quantities of multi-location advertising in this space, both online and traditional marketing, with clients in 36 states currently. So today's agenda, I hope that the crowd I'm speaking to right now is either considering expansion or is potentially getting into the space or investing in the space and trying to evaluate whether they should go after one big location or 12 outpatient centers or whatever the planning phase might be. So the goal here is to explore the expansion of the market and the industry with a little bit of financial info and just a few current trends. There is massive expansion of IOPs, or what has been referred to as the Florida model, that is expanding into other states where there is a residential housing unit, not on the same campus as a retail psychiatric treatment center, a private practice sort of a setup. There are outpatient centers expanding everywhere. This is still an epidemic level disease, and local services required for long-term care. Medically assisted treatment, whether you're for it or against it, there's a lot of debate in the whole country right now, even as insurance carriers are trying to form their opinions and laws are being passed. But love it or hate it, medically assisted treatment centers around the country are expanding like crazy. There should be a 200% to 300% increase in new medically assisted treatment programs this year. Today we'll be defining the key elements of marketing as a multi-location treatment center, right? So if you're the actual operator, you already have several locations or you recently expanded, what do you need to be looking at every day to steer the company in the right direction? We will describe the economies of scale afforded to you by multi-location marketing. So where do things get cheaper? Where do things get more effective? Why was this such a great idea? And it is. And we'll review and deploy tried and true tactics to expand your marketing without expanding your costs. So there are some freebies that you could very much be taking advantage of that a lot of treatment centers simply are not. And then finally, we'll explore the concept of a centralized brand name compared to independent brand names across multiple centers. This is a question I get asked every single time I talk to somebody that's about to open their second location. Should it be the same name, or should there be some kind of a theme parent brand? So we'll get into that today as well. Okay. So Captain Hindsight to the rescue. It's a whole lot easier looking at what your competitors have already done and wishing you had done it first than to deploy first-to-market strategies. So, those local guys stole 35% of our admissions, and they spent less money on marketing? But every time you try to find out how they did it, they just tell you something like, oh, we just took out a lot of yellow page ads. No one is going to give away their secret sauce. No one is necessarily going to be truthful with you on their cost per admission or their other marketing statistics. But realize that if you have seen someone go multi-location or come into your local market and grow, they're doing something right and there is some competitive advantage they have. So from a marketing perspective, I'd like to go into that today. So there's been an explosion of multi-location mental health and addiction treatment. We're seeing large hospital networks, primary care providers expanding into substance abuse and mental health. We're seeing private practice mental health operations gain private equity funding and go from 1 or 2 practices to 30. And we're seeing an unceasing epidemic. There's the disease of addiction, and the opiate epidemic has not decreased in years. And so we're at an all-time high, and we're faced with this challenge from a medical perspective. And so you see more investment coming into the market. You see hospitals trying to answer this call. You see investors trying to open bigger and better facilities. And then you're also seeing new entrants into the market. There's a huge influx of new technology and mobile applications and healthcare maintenance through EMR systems. There's been the emergence of telehealth. Can I talk to a psychiatric care provider in another state? Will my insurance pay for my own state? How does the in-network and out-of-network billing work for telehealth, which does have its own billing codes and is a whole other conversation? Medically assisted treatment and local marketing, right? So is it better to open one extremely large facility on one side of a major city, or is it better to open 3 facilities in different primary regions of that city, right? So medically assisted treatment requires going to where the customers are, going to where the patients are, in many cases due to the maintenance programs that it supports. And this is Suboxone, for example. Local marketing, again, you're going to your local market. You'll be finding a lot of aftercare, a lot of demand for outpatient services, but the marketing economies of scale are substantially better at the local level. You're not competing for that 3 to 10% of out-of-network PPO policies on a national level. You're looking to service local patients who have that local need. You're going to see that a lot of newly funded programs are emerging still. This industry very rapidly went from about $35 billion to mid-40s. That's in billion with a B. So huge investment, not a few million, not some startups, not some people newly in recovery just putting together a small program. These are massively funded, hundreds of millions of dollars kind of programs that are opening IOPs, outpatient centers, and large residential campuses across the country. You're going to see that their interests will shift towards in-network care and keeping their beds full at high quantity, as opposed to trying to skirt laws and make excess funds off of toxicology or have lower bed count but out-of-network benefits. And you're going to see the carrier mandates become more and more aggressive. If there is any change in healthcare legislation in either direction, it's an opportunity for carriers to change their rules, to delay payments, to freeze funds. So a lot of carriers are requiring specific accreditations, such as Joint Commission accreditation, in order to be paid. You're going to see them referring patients in network as much as possible, even if they have out-of-network benefits or coverage. And so you are going to need to do more advertising direct to consumer. You are going to need it to be made clear that you have your own market presence and patients have a decision that they can make in their addiction treatment. This is not a new trend, however, right? So this explosive trend, this rapid growth, this has happened before. This happened in the 80s. This happened in the 90s. So more recently, in the 2000s, there was a massive expansion of urgent care centers, and I'm sure you've all seen them pop up in your neighborhoods on a local level. Some of them are one of 500 owned by that huge medical system, right? And others are locally owned by orthopedic groups and urgent care service providers. So this feels new in this industry, and I get questions about this all the time. Like, well, when did it become popular to open 5 20-bed treatment centers instead of one real system of care at a 100-bed campus that operates as a mental health hospital? It's simply a choice. It's a marketing choice. Would you rather go local and have lower bed counts, or would you rather build a university campus or a hospital campus and centralize your treatment? So that really comes down to clinical standards, but that's what's driving these trends. There is new money, new technology, large demand from both educated and uneducated populations on medically assisted treatment, easier expansion into multiple states for IOPs and outpatient centers. You're going to see carrier mandates shift. And again, it's going to follow the same trends in marketing as local urgent care and expanded hospital networks. So what does that mean for all of you? What are we going to see as our challenge, right? The challenge is whether or not you need to be multi-location, right? You're asking yourself the question, is this an advantage? Am I saving money? Am I helping more people? Am I reaching a broader audience? So with this as the challenge, I think that the answer is simply that you need to go to where the customers are. If the customers are on a national scale, looking at TV, viewing media, clicking Google ads, whether they're regulated or not, then you would advertise there. And no matter where you're located, you would be able to, fill your beds. You would be able to provide care for high quantities of people. Is that a positive in addiction care, right? Going to where your customers are physically. So if you expand geographically, is that geographic expansion a sustainable strategy? Can you open another location in one other city and then do it again 12 more times, 50 more times, 100 more times? And so a lot of competition in the space has been national, whether you know it or not, due to this demand for out-of-network premium policies and that magical $30,000 patient. But at a local level, a lot of people can't leave their jobs to go away for residential treatment for 30 days or 3 months or longer. So you're going to be having to make this choice of whether you want to be a small fish in a big pond or a big fish in a small pond as a brand, as a service provider, and in your clinical care. Do you want that one-to-one treatment, or do you want that university hospital campus feel? And then what do your consumers consider in choosing providers? This is the single most important aspect of marketing, right? You can't have supply without demand. So what we've been hearing is fueling this expansion is a desire to maintain employment, a desire to not engage in complex travel, right? So it's difficult to fly from Colorado to Florida for addiction treatment. It's difficult to fly from Boston to Texas. There are medical considerations, right? When's the last time you used? Are you going through chemical withdrawal? Is there a chance you could die or lose consciousness on an airplane? And I've heard all of the nightmares, and many of you have read about them in the news, in the New York Times. But at a local marketing level, start the conversation with what you believe your patients are looking for, right? What are they considering first when choosing providers? At rock bottom, any choice is a necessary choice. And so somebody would say, look, I've relapsed 7 times. I need to get out of Dodge. I must travel for care. But have they tried outpatient care for 3 years leading up to that? Have they engaged with an IOP? Are they part of an aftercare program? So think about what you offer at that local level and whether or not that is what your patients are looking for. But there's good news, right? It goes beyond this challenge. You do not have to only think locally. However, it makes your marketing cheaper, and that's the world I live in. So hopefully this is a mind-blown scenario for all of you, right? The more locations you have, the cheaper your marketing gets. And that does make sense if you look at retail, right? Any big brand retail store like Best Buy, anyone like that, the more locations they have, the more you're simply aware that they exist, and so they can actually do less advertising once they have invested fully in their brand. That's not completely the case in healthcare marketing and addiction treatment in specific, but there are still economies of scale that we'll get into more specifically, and there are huge local advantages, right? So one is this perception of convenience, of simply thinking, oh, I don't have to completely leave town to begin my treatment. Now, that's not always the best choice clinically, but there is that consumer mentality. All consumers are looking for the easiest path to a solution, right? So if you're simply shopping for a car, you're going to look for a sale, you're going to look for a guaranteed trade-in value. So you're looking for minimal life interruption. In your own medical, if you had a choice for a surgeon that was across the country or a surgeon that had similar ratings locally to do a kneecap replacement or something, you would consider the local provider due to that minimal life interruption. And again, anyone who's on the clinical side of things, I can hear your brains right now. I can hear you thinking, that's not best for the patient. And what I'm saying is, fortunately or unfortunately, patients are shopping for local service, and they do need your level of clinical expertise. So consider going multi-location and expanding to where they are. The other consideration is a massive shift towards local online traffic on the search engines themselves. So Google absolutely prioritizes local search. They automatically add the words near me to the end of most searches. So if someone types in, rehab center, men's rehab program, Google is adding the words near me, and you will see local results prioritized, even above paid advertising in many cases. Google, in an effort to regulate unscrupulous AdWords spending, made a massive gesture in that front about a month or so ago, and they're still continuing this effort in regulating, and regulating spend, but that gives your local online traffic an even bigger boost. Most of our clients have seen about a 15% increase in local search since Google started regulating their own AdWords product. The other consideration for your multi-location marketing is business risk. If you have 10 locations that all have the same brand and the same name, what happens if something goes wrong? What happens if one of them engages in a lawsuit or there's a patient death or something goes wrong? But at the same time, if you have 10 locations with completely decentralized brands, totally independent of each other, then there's risk that people won't realize you'll receive the same level of care at each of these locations. So as we get into the mindset here, right, that there is an advantage to multi-location marketing. There is a massive demand and financial backing for this expansion to get to where the patients are, right? And the fact that we're not all there is helping to perpetuate the epidemic. Here's where we need to start planning, right? And this is where we get strategic, then we're going to get tactical, then we're going to take questions. So considerations for the brand. Start thinking about that risk, whether it is social reviews impacting one location versus your entire brand, whether it is a lawsuit, whether it is a patient death. You need to think about crisis communication in your marketing and whether a crisis can be contained at a local level, just as much as exceptional service could be promoted at a local level. You need to consider the larger presence advantages for word of mouth if you stay with one brand, right? So if all 10 locations do have the same name, more people will have heard of you, more people will feel comfortable referring to you, your alumni base will all identify as having gone to that parent brand for treatment, and your colleagues and events and continuing education credits offered on location, they're going to view you as a larger service provider as well. So there are advantages and disadvantages to that centralized brand or decentralized brand, and you need to be assessing those from a perspective of risk versus potential reward from referral business, alumni, word of mouth. Your domain names. I have an opinion here. A lot of SEO experts will tell you that they do not care whether you build multiple locations into one website or whether you build multiple websites and maybe a parent website for the whole company, right? We have seen tremendous advantage to building multiple domains, multiple websites. So if you have abctreatmentnewyork.com and abctreatmentcolorado.com, as long as the content on those sites is unique and localized and you've used schema technology to promote and verify those local addresses and you've claimed Google local listings for each of those businesses, we have seen that drive more admissions directly than a centralized brand through a centralized website, even if they did everything else right, by adding multiple addresses and multiple galleries of facilities and that sort of thing. So with your domain names first, and then the concept on actual websites, it is advantageous, in my opinion, to go more local and build more tailored titles in your content and your domain names themselves. Now, local advantage beyond that goes into the way software is built. So geo-targeting, geolocation, the fact that more than 50% of internet usage in America is on smartphones now, it means that tools like Yelp and social media, it means that search engines like Google and their local listings, which is called Google My Business, those things are simply increasing in both volume and importance. And consumers feel very comfortable with them because they're not paid ads. It's easier for you to promote multiple business addresses, easier to rank locally when you have those local profiles to support your website. And you're going to find that you can get a much larger quantity of listings. If you have a centralized brand and one website, you can only really create one affiliated social media account with that website on each primary platform. If you have 10 websites, you can create 10 different Facebook pages, Google My Business accounts, listings on business directories, that sort of thing. So there is a quantity play that can be made here. And to my Captain Hindsight reference earlier, it's not the yellow pages that's giving your competitors the advantage. It's simply having 10 Facebook accounts instead of one. So that's the mentality. As we're looking at these key elements, what can the marketing message be? How do you leverage this into your actual communications? And then how do we take those communications and leverage them into an actual campaign? So the concept here is being big enough to serve you, right? We have expanded and we're providing better care than ever. Even if you're a local clinician with a one-room office, if you open a second office and you go to 1 in the morning and 1 in the afternoon, but it's across town, you will find this to be true, that you are now big enough to serve a much broader audience and a much larger marketplace. If you can be dynamic in your local marketing, then it can be done at scale. And that sounds generic, but it's actually quite specific, right? If you are a national or regional brand, you can be known nationally under one name, even if each local office or local facility has its own name, right? Treatment Horizons, an ABC company, or Treatment Horizons, part of the ABC mental health system of care. You've seen brands like this. You've seen major hospitals do this. Locally, where we're headquartered in Baltimore, Johns Hopkins has a world-famous autism unit called Kennedy Krieger. Locally, everybody knows that they're associated, but globally, Kennedy Krieger has a standalone brand and can do independent research with or without Johns Hopkins. Then there's the concept of being small enough to know you. A lot of people that have been to larger treatment programs or some of the national providers or the publicly traded providers, whether they received great treatment or not, they oftentimes, when they relapse, will blame the actual treatment center for their relapse. And so they'll say, well, I went to one of those big fancy treatment centers before and it didn't work. I want to go somewhere local where they're going to learn my name and I can feel like I'm getting that warm, friendly level of service. You're going to find that perception to be much more agreeable with zoning committees, local communities, communicating with families and alumni, hosting meetings locally, doing aftercare locally, reaching out into the community, doing public education for students to stay away from drugs. So this marketing mentality, as we've defined the market, and now you're starting to think through what that could look like for you, try to maintain that mentality of being big enough to serve you, and in all your communication being able to say that, like, well, we have everything you need, but we're local. We're right down the street. And you will see a lot of universities that have gone multi-campus use that mentality. So, what are the economies of scale here, right? How do we save dollars? How do we make more dollars? Which channels are advantageous? To quote the great Paris Hilton, it'll work. I'm a marketing genius. That's how I want you all to feel today, that going multi-location was a very intelligent move for your business. If you're considering it or evaluating the cost of it, it is very favorable to your marketing. Double-digit percentage savings on every admission. So where do you save this money? You save this money on maintenance and security of all of your web platforms and all of your technology. You save that money on your licensing for your EMR and your software. Content management systems can be linked together. If you're using a technology like WordPress to fuel your websites, there are WordPress multi-site setups. There are plugins that would allow you to manage all 10 of your sites through one login. So the economies of scale can actually shift over to labor, and this includes web design labor. If you have one awesome design that you have perfected for the parent company, you can redeploy that the same way a franchise organization would. So each local site could be the similar look, feel, and theme, but if one is on the beach and one is in the mountains, you could have that local photography, local employees, with the right accent, speaking to the right audience. It's real tough to see someone from the South speaking to someone from Boston, and they're trying to use the same words, but they have to keep repeating themselves to each other. So some of these economies of scale, right, on your technology platforms and the actual assets you have per location, you're saving money and time at the same time. You can build these websites quicker with less man hours. And then ad and brand standardization. So you can advertise the parent brand, and you could do that regionally or nationally. And then at a local level, you can simply advertise that one location and its independent name if that's the direction you went. And you'll find that it is cheaper to advertise the parent brand many times, but you're gaining free tools and more free business listings and low-cost listings when you go local. So that said, which channels work best? Paid media and PR work very well for a parent brand. That even includes television. I hate saying radio because I have not seen it convert anywhere near as well as other channels, but some very large, very well-funded brands recently have been leveraging radio, and it is driving huge brand recognition and consumer awareness for them. I'm not sure what it looks like in admissions, though. So the channels that would work best for the parent company would be paid media. That can include AdWords, TV, radio, even print. I've seen a lot of parent companies have a booth at industry conferences, and it simply lists their multiple locations, and each location might have its own name or brand. Now, digital and SEO and event marketing, even your sales team, all of this can be done by location, and that actually makes it less expensive. To rank locally, you don't have to produce nearly as much content as you would need to produce to rank nationally. If you want to be number one for Tallahassee Women's Treatment Program, that is infinitely easier to accomplish than ranking number one for Florida Women's Rehab Program. So at a local level, the fact that you can create some of these free profiles and garner more business listings and verify your address in more places, your advantages will be gained by having decentralized brands. And on a paid media level or a PR level, you should reference all of your brands under an umbrella company or a parent name, ideally, so that you're not running 12 ads or 10 ads of different names with the same message. So Dan, are you saying that I'm a genius for marketing multiple locations at once? Yes, I am. And if you're not doing it yet, I'm saying that you would be a genius to expand your model. You'd be amazed that some of the other markets that you're not operating in have substantially more demand and better insurance coverage. I have recently witnessed a large influx from both California and Florida, specifically into Texas and Colorado. So keep that in mind, that there are other states, other markets that have growing problems and are not adequately resourced to fight the epidemic. So let's talk about your budget, and we're going to shift over to questions in about 15 minutes here, but the budget is a consideration I get asked about all the time. How do I allocate my budget evenly, right? If I have 10 treatment centers, do they each get 10% of the budget? Because they will find out if one is better funded than the other, and they will complain loudly. And then do you have a centralized marketing team managing all of that, or is it managed at the local level, and there's not really any parent company marketing going on? So consider which percentage of your budget goes to each location based on what percentage of your revenue is generated by each location. If you have one that is in a major market with huge populations, they might need, due to competition and demand, they might need the lion's share of your budget. And if you go out to Omaha, Nebraska, they might only need 2% of your budget because it's that much less competitive. And no offense if anyone is from Omaha, Nebraska, it is a lower population than New York, and that is a fact. So does each location offer the same service? You could consider putting your marketing budget towards very specific niche marketing at each location. If one location has a wilderness program, or one location has additional housing for women that another location doesn't have, you can go after these niche markets at much lower levels of spend than having to advertise those services nationally. And then again, do you have the same marketing staff at each location, or has that staff been centralized, or do you have twice as many outreach people at one location as you have at another? So the best way that I have seen, the most effective way to drive profitability from multi-location marketing in addiction treatment, is to look at the percentage of revenue that you either are already getting from each location, or if you're expanding, what you would plan for that location to bring in the first year or two, and set your budgets accordingly to that percentage. Reusable assets. This is my favorite thing ever. This is what allows a low-cost marketing asset to be deployed over and over again with great returns, huge return on investment, and it can be branded or unbranded. So video as an example, a branded video for your entire parent company, that could be used on every single local website. A testimonial, a partner, a professional colleague that's comfortable referring to you, your alumni, families that have amazing stories of recovery and their own learning about the disease and their own coping mechanisms to avoid toxic relationships and such. I mean, some of these stories are extremely emotional, credit you with life-saving events, and in this scenario could be used across your entire system of care as long as you're comfortable that the clinical treatment is on par at all locations. So start thinking that way. We produce a lot of infographics, and that's the kind of an asset. A blog, you don't really want to have duplicate content across your websites. But on the digital side, an infographic, a video, any kind of a cool piece of media, that could be used system-wide. And so you only need to produce it once, but you can use it. It has a shelf life of years. Social media, you could produce one asset and distribute it with different dialogue across multiple social media channels on each of your 10 local profiles. You can demonstrate which facilities you have and which amenities they have. You might have one building that has shuffleboard and another that has volleyball. But you want to be very careful. I've seen national brands make huge mistakes that looks like false advertising. They'll say, hey, we're right next to a golf course. Hey, we've got a pool. Well, yeah, one of their locations does, and a different location is by the golf course. But that admissions rep just lied to your patient if you have centralized your call center and they're not talking about one location to the prospective patient. With your social reviews, anytime you're referencing the parent brand, especially if you're a high-end program, the conversation cannot be about luxury. It needs to be about transparency. And so when you produce these reusable assets, right, don't overproduce them. Let them be sincere. Let them look like they were done at the local level, and simply multiply that effect across your system of care and in your marketing campaigns. So focus on reusable media assets, and then advertise them, a campaign about them, and share them out across every location. So let's get tactical. How do you do that? First and foremost, hyper-localized SEO. You need to use geographic keywords on all location websites. Every town, every county, every city. Verify your addresses using Google Schema. That would be done through Google Search Console. You can use a data highlighter tool, or a web developer can manually code schema into your website. That is what actually gets your listing onto Google Maps. That technology references where you're located and what your site is about. So it kind of pairs the old concept of just keywords with the new concept of, if you're searching for what's the best pizza place in town, Google knows what town you're in and that you're looking for pizza. Event marketing and outreach teams per location. Staffing ratios are extremely important, because if you're advertising nationally, but you have understaffed or overstaffed at specific locations, you're going to find your admissions numbers way out of whack. So event marketing, make sure that you have some kind of themed, consistent events across your whole system of care at all locations, for alumni, for group meetings, for family education. That's a huge opportunity when you go multi-location, because 6 degrees of separation, everybody knows somebody struggling with addiction right now. Everybody. And most people, it's 5 or 10 or 50 people that they know. So to do local outreach and host local events, even barbecues and a sober kickball team and things like that, those are nitty-gritty tactics you can do locally that you cannot do as a national brand, not as easily. Multiple websites, multiple domains. I highly recommend that strategy for multi-locations. It can be accomplished through a central website. I just find it to be substantially easier on labor. You could get a lower technically skilled group of people and they could still accomplish your goals with this. But go multi-site and go multi-domain. Use schema, again, for all addresses, every single address, everywhere they show up. And you can use your multiple websites and those addresses to actually promote your other locations and link to your other websites. So there's an inbound linking advantage between these assets. You need to be conservative with it, and you need to not duplicate your own content between sites, but take advantage of that. Google themselves, their free tools like Analytics and Search Console, you can install a unique Google Search Console account per site, and that will help you to get the entire site indexed. Google will see, okay, these sites all seem to be related to each other, but not overlinking in a spammy fashion. And then it allows you to leverage free listings. If each site has its own domain name, you can go on sites like Google My Business, Facebook, Instagram, Twitter, all of these accounts that you can create for free and link them to your URL, to your local web address. And you're going to find that those social profiles by location will help you to rank higher in search engine results by location. Google does cross-reference your phone numbers, your addresses, what's showing up in your listings, and what's showing up on social sites. And then I want to talk about your systems. What are you using for admissions themselves? How are you generating calls? How are you handling those calls, even on a local level? And what you'll find is with your EMR, with any kind of a CRM system like Salesforce, when you go from one location to several, it's a whole lot easier to deploy it the second and third and 20th time than it was to deploy it the first time. And it's also typically less expensive for multiple user licenses. So if you have 2 admissions reps and 2 phone lines at one location, your cost does not simply double every time you add another location. Typically, you get some economies of scale on, one-time monthly fees and then a cost per usage. You're also going to want to be comparing your data between markets. You might find that you have exceptional staff at one location. You might find that you have exceptional clinical care at one location. And and you need to learn from that data. You need to deploy it and share it with your other locations and up at the management level and the investor level. That is how you can tactically use systems that only multi-location operators would be using, right, as a competitive advantage to more tactically spend your money, to more tactically do your staffing. And all of this is going to give you a smoother admissions flow when all of your admissions are handled all the same way across all of your locations. One location isn't really testing how smooth their process is. They feel like they have it down. Their conversion rates are pretty good, but they don't necessarily know what they don't know. Well, when you have multiple locations, that's exactly the information you can find out. Why does Treatment Center A have a 10% close rate on phone calls to admissions, and Treatment Center B does the exact same marketing, and they only have a 5% close rate? So as a marketer and a tactical multi-location marketer, now that you're a genius, look at these systems, use this data to fuel your growth, and year over year, your budget should become more efficient, if not month over month, week over week. With this lots and lots of data, it's going to fuel an accelerated growth. So a lot of treatment centers, when they go from one location to two, they then grow from 2 to 4, or 2 to 10, or 10 to 50. That recipe for expansion, you can scale it somewhat infinitely. Your market research would be comparable in identifying new markets. Your local risk would be hedged because you can start small and grow in a local environment. As employees move, as you see certain top performers show up, potentially they want to move to a different location and do it all over again and build you another victory and put another feather in their cap. That might cost you the cost of them moving, the cost of them producing those results, but look for your rock stars, identify them, and build a system and a process around how they're succeeding, and realize that that can move to your other locations. And then your clinical model can scale. If you have exceptional staff members or just very diligent employees on the alumni side, on the treatment side, as techs, even at the local level, that clinical model can scale. You can study your own locations to fuel better care at your other locations. You can even beta test new ideas at one location and not deploy them system-wide. So keep that in mind, and then realize that your media costs are easily replicated and easily scaled and done tests in local markets. And food for thought here. We're almost done, and we'll hop over to questions. Different audiences exist in different markets. Okay, people in Texas think very differently about addiction than people in Boston do. Chicago's drug problem is similar to Baltimore's drug, but very different from California's drug problem. And I'm talking about the actual substances, the distribution channels, the violence. So these different audiences in different markets allow you to actually increase your niche targeting, right? Talk to a specific group of people. And that can often be less expensive and less difficult to do. If you're in New York City and you're just trying to reach out to executives and financial professionals, you can do that through LinkedIn pretty effectively. But if you're looking for that 18 to 24-year-old opiate crowd, you're not going to find them on LinkedIn. Your sales outreach, your ability to hire and staff outreach people, your online marketing, your offline marketing, your professional referral partners, these groups can all be marketed to in different ways in different markets. You're going to find faith programs having tremendous success in certain regions around the country and very little in others. Medically assisted treatment in urban markets does better than the same concept, where in rural markets the preference on the consumer side is actually abstinence. So tailoring your messaging, or even tailoring specific locations to the market that they're in, this is going to allow you to very much fine-tune your budget, fine-tune your communication, and instead of screaming the same message over and over and over again from the mountaintops, you're going to get a message that, when it boils down, resonates with much more impact to whichever audience you're speaking to. So keeping all of that in mind, hopefully we accomplished this for you today, but the consideration of expanding into new locations, or if you're already multi-location and trying to identify areas of key advantage as a marketing mover. Hopefully, we properly explored this expansion. We look to define the key elements of marketing as a multi-location center and the economies of scale that are afforded by that. I gave you a few tactics, especially my preferences on multiple websites, multiple domains being a key driver of that success, and some concepts about centralized brand names compared to independent brand names. So with that, I will hand it back to Tom, and we'll talk through some questions that you folks have been sharing. You will see me the week after Thanksgiving in Dallas at Recovery Results, as well as the Treatment Center Investment and Valuation Retreat in Scottsdale, December 4th through 6th. And we'll leave this link on your screen for a minute. We have a lot of free resources, white papers, and past webinars available at dreamscapemarketing.com/resources.
All right, Dan, thanks a lot. That was some really good stuff. We've had some questions coming in from our audience. However, we would like to remind you that you can use the Q&A area below the slides on your screen to submit a question at any time here over the remainder of the hour. And if you're interested in downloading the slides from Dan's presentation, they are available in the Resources tab to the right of the presentation window. All right, let's get into some questions. Dan, one of the things you had mentioned was in terms of setting your budget over multiple locations, it might be more expensive to be marketing in New York versus Omaha. Can you just kind of give us some guidelines in terms of what to prioritize, maybe between your different marketing channels and not necessarily tied to geography?
Sure. So the platforms that are more equal, and the question is, how do you establish your budget in a market like New York City compared to Omaha? Looking at population and number of competitors is how you would begin your market research. In terms of setting your budget, I often look for which platforms, which media, which tactics like SEO and local marketing are level playing fields. So in either of those markets, I would begin with business listings, directories, and then search engine local listings. So like Google My Business, Bing and Yahoo Local, which is actually powered by Yelp, and then Yelp itself. Those things are free, they're low budget, and they're a very quick starting point. They're also equal. You cannot, in New York City or Omaha, have priority over any other place by spending more money. In terms of media spend, I think you do need to factor in population and competition. If the population is 300% larger, you may need to invest 300% more to reach the same number of people effectively, to obtain the same market share. So scale population with your budget. You will find that this epidemic is everywhere. We have not found local markets that are unable to drive admissions.
All right. Next question we had come in. Can you clarify what you meant by the black sheep of healthcare?
Sure. So this is a white paper that we recently published. It's called The Black Sheep of Healthcare, Behavioral and Mental Health. It explores the history of addiction treatment and mental health in general, straitjackets and shock therapy up through the 1900s to where we are now. And then it also explores issues with fraud and patient brokering and why this industry has struggled with corruption more than other healthcare sectors. So that general concept, the black sheep of healthcare, it's not derogatory by any means. It simply meant that the mass marketplace and hospitals and providers in general struggle to identify with and properly approach mental health.
All right. Staying along those lines, one of the terms that we hear in marketing is black hat marketing techniques, and that runs in contrast to all of the very good sound practices that you were outlining for us today. Some of those more unscrupulous tactics, are there some things that you would suggest our audience particularly not do in their marketing plans, and things that are especially bad that they should be cognizant to avoid?
Yes. So black hat marketing, it's a series of tactics that may not be illegal, but they sure are not fair. And there's been massive outcry about this all the way up to Google, lots of lawsuits about this. But anything that is infringing on someone else's trademark, if you're creating a local directory on your own site and listing competitors on it, don't engage in that. That is actually now being policed by Google. There's been national issues with treatment centers going out to Google My Business and suggesting an edit. And Google had this feature active for a long time where if a pizza shop went out of business and a new business was open in that location, you could change the phone number, you could change the business recommendations, hours of operation and such. That is now being policed by Google as well. So a lot of these things are not really available options to people, but I would highly recommend staying away from other people's trademarks in any of your content, and I would highly recommend staying very far away from false locations. So using a P.O. box or a UPS store as an address to appear local. The FBI is currently aware of that tactic, which poses advantages on the internet, and it is very shady and will soon be very strongly enforced from what I understand. So don't create fake locations. It will come back to haunt you.
All right. Reminder to everybody, if you would like to submit your question, we have that Q&A area below the slides on your screen, so go ahead and hit that up and submit your question here over the remaining few minutes that we have, and we'll try to get to that as well. Another question that has come in, you had referenced the importance of having unique content on multiple sites. If you have multiple locations that are offering very similar services and treatment options, how much can you rework your content to basically convey consistent messaging while also being unique? Are there any sort of tips you can offer on that front?
Yes. So if you were writing about the same program at two different locations, this is the challenge in content marketing, right? So your men's heroin treatment program at location A and location B. How do you write about that differently such that it's not duplicate content? On a technical level, if 30% of the words are in the same order in those two pieces, search engines will mark it as spam or not rank that page, not index that page. So one page, whoever produced the content first would rank and the other would not. There are tools available to test that. Our favorite is Copyscape, COPYSCAPE. And Copyscape is in use by some of the search engines. That same platform is integrated for them to track duplicate content. It is a challenge. You would need your team to creatively write about the same program from a local mindset in each location. So if you're referencing the beach or versus mountains from one location to the next, make sure to expand on that concept, include lots of words around it, and town names. I mean, again, additionally, leverage those geographic keywords in your content, and that will help you to separate out, Orange County, California addiction treatment from, Jersey City, New Jersey addiction treatment.
All right, very good. I think that's a good stopping point for today. So I want to thank Dan Kemp for an excellent presentation. I'd also like to thank our sponsor, Dreamscape, for making today's program possible. And finally, thank you to those of you in our audience for participating today. We hope you join us in the future for another Behavioral Healthcare Executive webinar. This concludes today's presentation. Have a great day.
Thank you all.